3 things to know about your dental implants. And no, I'm not talking about how to place a dental implant or what a dental implant is. I'm talking about the specific dental implants that are in your mouth. Hi, I'm Dr. Rich Petrowski. I'm a general dentist with over 25 years of experience. I'm teaching you about dentistry and teeth so you can have a very nice smile, and so also you don't get taken advantage of when you go in to see the dentist. Okay, so this topic is something that no one seems to really think about. And people will go in, get a dental implant, and they think that a dental implant's a dental implant. They're all the same, aren't they? Well, no, they're not. There are over 200 different brands of dental implants out there in the world. It's important to know what you have specifically in your mouth. So we're going to go over the 3 things you should need to know about your dental implants. Now, why would this be important? Well, what if you move? Nowadays, everyone seems to move quite frequently. You change offices. What if you change offices and what if your dentist moves? What if your dentist retires, passes away, whatever, and you can't get the information? So it's important you have this information after you get a dental implant placed so that next time you go, years later, if you go see another dentist, something happens with the implant, you can give them the information and they can fix the dental implant. They'll know what they need to get to take care of your dental implant. The first thing to know about your dental implant is, what brand is it? Dental implants there are many different brands and manufacturers of dental implants. When I check, there's over 200 different dental implant brands out there in the world. Not all brands are available in every single country, so it's important to know what brand you have. And I've seen some cases, I'll put up an x-ray to show you, where the person actually has multiple brands of implants. You would think, they have a bunch of implants, they're all going to be the same. No, they have all different ones. Sometimes it's all one brand on top, a different brand on the bottom. I've seen some people have various brands, all depending on what dentist placed the implant. And that dentist happened to use whatever they were most comfortable with or what they had on hand in the office. And so if you ever change dentists in the future, it's good to know what brand of dental implant you have so that the dentist can order the correct parts for your implant if you need something repaired on it. And also, they need to be able to have the correct tools to work on the dental implants. Again, most people think the little screws that hold the implants in, they're all the same, but unfortunately they're not. Some are common, just very small hex sizes, like 48 thousandths or 50 thousandths, but then a lot of brands actually have their own unique type of driver. The little screw head is its own unique style. Some look more like a Torx, but not quite. Some almost look like a Phillips screwdriver, but not quite. And it's important to know what brand you have so the dentist can make sure they have the correct tools. And then there's some implant brands out there, one in particular that I can think of, Megagen, which requires actually a special tool to remove the post from the implant. It's not just a matter of loosening the screw. You loosen the screw will come out, but the post is still attached to the implant, and they actually require a special tool to help remove that post from the dental implant. Another thing, all these different brands require also different torque specifications for those screws. I found a chart online, and I'll leave a link to it down in the description. So if you're a dentist or a dental lab tech or just someone who's curious, you can look that up and you'll see all the different brands, what type of drivers they use, and what the torque specs are for their particular implants. It's funny, some brands too, even though you would think the brand should be the same torque spec in that brand, but they'll have different brands depending on, that brand. One brand will have different torque specs for different types of attachments that they use. Not all attachments are attached with the same amount of torque. Now, there are some services too that can help you figure out what dental implant is in your mouth based on a dental x-ray that's taken. Usually your dentist can take a PA or a Panorex of your dental implants, and there's a website called What Implant Is This? I believe. I'll leave a link to it down in the description, where for a fee they'll figure out what implant it is based on other models. There's also some companies, one company in particular, Implant Direct. They have a couple employees that are really good just by looking at the dental implant. They can pretty much figure out what brand of implant that is, what brand and what model of implant is. I've used them in the past. Darwin is a great resource. So, and that leads me into item number 2. Not just what brand, but what model of dental implant that you have. Different brands of implants make different models of dental implants. So just like a Toyota makes a Toyota Camry, makes a Toyota Corolla, makes a Toyota pickup truck, makes an SUV, a minivan. There's all different models, but the parts are not interchangeable. The transmission from a Toyota Corolla is probably not going to work in a Toyota pickup truck. So the same thing with dental implants. A connection, a part for one model of dental implant may not fit a different model of dental implant. So it's important to know your model numbers because the parts may not be interchangeable and compatible. You have a Nobel, that's the company that makes the implants, but they can have different models of implants. They can have the tri-lobe, the internal hex. They can have, new one now is the Nobel Active. Same thing with companies like Straumann. They have 3 or 4 different types of dental implants, different models of dental implants. So it's important to know what model you have in addition to what brand you have, because again, the parts are specific for those models. The parts are specific and the torque values for those models are specific as well. Again, link to the torque chart and driver sizes down in the description. Also important to know because sometimes some models of implants do get discontinued and makes it more difficult to find parts for them. I had a gentleman a couple years ago came in, he had 2 implants replacing his upper front teeth and the post broke. Not the implant, but the abutment post that attaches the tooth to the implant. I had the name, I had the brand, but I looked it up. That company got bought out. They no longer make those posts. So we ended up having to make them a denture because I couldn't use those implants to put new permanent teeth on them. Now, in some cases though, if it's a very popular brand, not only can you order parts from the company, the original company that makes it, if it's a very popular design, there'll be other companies out there who will make what are known as clones of it. So basically implants that look very similar to it and the parts are interchangeable, so you don't necessarily have to buy a Nobel. You can, a company called Blue Sky Bio makes clones of the Nobel Active, so they're cross-compatible. I believe Implant Direct also makes a copy of them too. So you have other sources to get parts for the implant, and that's why it's important to get a pretty common implant, not some very unique one. Now, a lot of times too, over the years, the different models have changed. So back when I first started practicing in the late 1990s, the most common implants that were placed back then, which were called external hex. So there's actually looks like a little nut on top of the implant that the abutment post sits onto. Since then, those designs have been replaced with what was called an internal hex implant. Basically, instead of that hex nut being on top, it's recessed in there, and so the post fits into it. Nowadays, it seems that all the companies are switching over to something called a conical connection, which has a taper to it, which again, it'll just lock it in better, it stays in place better. And then there's also some brands that have been using the same design since they were first introduced. 2 that pop into, off the top of my head, the 2 that I can think of are Bicon. They've been using the same basic design, just in different sizes since the mid-1980s. So an implant, a Bicon implant that was placed in 1987, you can still buy parts for it, and the new parts will still fit into that old implant from 87 to 35 years ago now. Another brand too that is similar to that is a brand called Ankylos. They've been using the same connection for quite a while, and those are still available. So as I mentioned, the Bicons, same type of connection, but in 3 different sizes. That's the only difference, and that leads us to item number 3 to know about your dental implant, the size of the implant. So implants are sized in both the diameter of the implant and the length of the implant. Of the 2, for you, the diameter is the most important. Length, not as much, because that could be easily measured off the x-ray. But the diameter is important to know because for some brands and some models of dental implants, depending on the diameter of the implant, the connection, the abutment, how it attaches to the dental implant, that connection can be different based on the diameter of the implant. A smaller diameter, narrower diameter implant may have a different connection than a fatter, wider diameter implant. That nowadays too has started to change. There's been quite a few companies recently that have come out with models of dental implants that use the same connection pretty much no matter what the size of the implant is. So even if you have a 6 mm wide dental implant, it has the same connection as a 4 mm wide dental implant and all the sizes in between. So that just makes it easier for the dentists and the labs. They don't have to stock as many different parts as opposed to the old days where you needed a different parts for every single every size of the dental implants that were available. Implant lengths have been changing though too, which is interesting to see. I have some patients that have had implants placed years ago which were very, very long. Here's an x-ray of a case where I had a patient with, I think it's a 12 mm long implant next to a newer implant which was only 5 mm long, and so it just kind of weird seeing that juxtaposition of a very old school style to a newer, more modern size of implant. Alrighty, so to sum it up, the 3 things you got to know about your dental implants is what brand of dental implant they are, what model of dental implant it is, and what's the diameter of the dental implant in your mouth. Anybody watching switch dentist and their new dentist couldn't figure out what their implant was? Please leave me a comment down below.